A wonderful day to you all. Welcome back to the channel. Today's episode is rather special to me because the topic was suggested by my professor, Dr. Somnath Saha. So, a big shout out to sir. And with that, we get into today's topic, which is the contents of the middle ear. So, essentially, based on their state of matter, you can classify them as gaseous and solid. The gaseous content, as we know, is air. So the air is essentially the most important content of all, and at postgraduate level we need to remember that approximately 0.5 ml or cc of air is the minimum requirement for normal middle ear function. So the solid components are bones, muscles, neurovascular structures, and the mucosal folds with the tympanic diaphragm. Now, coming to the bones, they include the ossicles and their articulations. So the ossicles that we all know and love are the malleus, incus and stapes. Their articulations are the incuro-malleolar joint and the incuro-stapedial joint, both of which are synovial, diarthrodial joints. Diarthrodesis is essentially depicting the fact that they are highly mobile joints, and the incuro-malleolar joint is in the attic area. So now coming to the muscles, they are two in number, tensor tympani muscle and the stapedius. Tensor tympani muscle is supplied by the trigeminal nerve through the nerve to medial pterygoid, and the stapedius is supplied by the nerve to stapedius, which is essentially from the seventh nerve. Now coming to the neurovascular structures, nerves and vessels. So the nerves are the branch of the cranial nerve 7, which is the facial nerve, that is the cauda tympani, and the nerves in the tympanic plexus. And also the tympanic plexus is the origin for another nerve, which is called the lesser superficial petrosal nerve. Now coming to the vessels, there is a subclassification here, which is normal vessels and the aberrant vessels. So first we have the normal vessels. Firstly, we have the anterior tympanic artery and the posterior auricular artery, both of which are derived from the internal maxillary artery. Then we have the superior tympanic artery and the superficial petrosal artery, both of which are derivatives of the middle meningeal artery. And then we have the caroticotympanic arteries that are derived from the internal carotid directly. And lastly, we have the inferior tympanic artery, which is from the ascending pharyngeal artery. So we see here that there are three tympanic arteries: anterior tympanic, a superior tympanic and an inferior tympanic artery, all of which are derived individually from other with separate primary trunks. So lastly, we have the aberrant vessels. These are variations from normal anatomy. So the two vessels we will be dealing with are the persistent stapedial artery and an aberrant internal carotid. The persistent stapedial artery is a known cause of pulsatile tinnitus in patients. So we should keep this in mind while assessing a patient with tinnitus. And aberrant ICA is one which takes an aberrant course through the middle ear or tympanic cavity. So it can present as a whitish mass behind the tympanic membrane in the anterior inferior quadrant of the middle ear. So the problem here is that if we do not bear this in mind, and if we try to take a biopsy from this, it will result in a catastrophe. So lastly, the tympanic folds and diaphragms are very important from a postgraduate point of view, but however they would need a separate session for discussion, and so I'll do that separately. Now finally we'll revise the whole thing once, just the headings. The contents of the middle ear are the bones, which are the ossicles with their articulations, the two intertympanic muscles, the neurovascular structures. The nerves are the chorda tympani and the tympanic plexus, from which the lesser superficial petrosal nerve comes. And we have the vascular structures, three tympanic arteries, three more arteries, and finally we have the mucosal folds and the tympanic diaphragm. And we also have the aberrant vessels. So thank you guys for watching. Please do like, share and subscribe, and let us be a part of your journey.